December 1st is World AIDS Day, a day devoted to raising awareness for the fight against HIV and AIDS. But does the public have an accurate perception of the disease? DePaul students were asked what HIV meant to them.
HIV is having an unprotected sex, and then it's a disease that you'll get out of it.
Stay away and stay clean.
And it's, once you get it, like, you can't go back. You have it for life.
Students knew that HIV was something they wanted to avoid, but not much else. So for those who don't know, what is HIV? HIV stands for Human Immunodeficiency Virus. In short, HIV attacks and weakens the host's immune system, leaving them extremely vulnerable to other diseases and infections. Dr. Daniel Berger is founder of North Star Medical Center, the largest private HIV treatment and research facility in the Chicago area.
Well, HIV is a retrovirus, so it replicates itself differently than other viruses. There are a lot of unique aspects about HIV. It attacks the immune system cells.
A retrovirus is one that must use other cells to replicate itself, like a parasite. In the case of HIV, those host cells are CD4 T cells. The virus infiltrates them, producing replicas within. When the process is complete, the original cell is destroyed. As the process is repeated, the body loses more and more cells. If left untreated, the patient will develop acquired immunodeficiency syndrome, more commonly known as AIDS. Jill Dispenza is the HIV director at Chicago's Center on Halsted, a community center for the gay community. She explains the difference between HIV and AIDS.
HIV becomes AIDS, it's a clinical diagnosis. So if somebody has an opportunistic infection, which is an infection, there's different kind of pneumonias, Kaposi sarcoma, there's certain things that people who are healthy, they don't have an issue with, but somebody whose immune system is really compromised, they'll get these kind of odd diseases, which is how they started to discover it. Young people were coming up with these bizarre kind of infections and diseases, and it was because their immune system was shot. So it's either an opportunistic infection or somebody's CD4 cell count has gone below 200. That's it. So those two things can mean that you get an AIDS diagnosis.
So HIV can be fatal, and measures should be taken to prevent its spread. But what measures are those? How does one contract HIV?
It's transmitted by sharing of body fluids. So we know that, for example, during sexual intercourse, there's a sharing of body fluids. So that's an obvious way that it would be transmitted. We also know that individuals who share needles, because there's blood, usually that gets exposed from one individual to another, that's another sharing of quote-unquote body fluids.
So through these activities, anyone could contract the HIV virus. However, according to the Center for Disease Control, about 80% of the HIV-positive population are men. And of that number, 80% are gay men. That means almost 65% of those living with HIV in the United States are homosexual men. Why is HIV so much more common in the gay community? John Peller of the AIDS Foundation of Chicago says that this is because of the fragile makeup of different parts of the body.
One of the reasons that HIV is easily transmitted rectally is because the makeup of the mucous membranes in the rectum happen to be about 2 or 3 cell layers thick. It's not particularly thick cell layers, and there's also a lot of white blood cells in the rectum, and that's exactly the kind of cells that HIV adheres to when it goes to when it infects someone's body. And the vagina, by comparison, is much tougher. It's made for popping out babies, so it's much more resilient to tearing or any kind of abrasion that is very much a factor in HIV transmission.
Today, there are 1.2 million people living with HIV in the U.S., and 1 out of every 5 do not know that they are infected. Though HIV infection is still prevalent among the U.S. population, many negative social stigmas still remain about the disease.
HIV is a virus. It's not a punishment for bad behavior, it's a virus. If somebody catches a cold, we don't say, oh, that person did something wrong, that's why they caught a cold. But HIV has a lot of stigma to it. If somebody has diabetes, people don't run away from them and not eat off of the same plate and kick them out of the house and things like that, where HIV still has that.
Though so much has been done in the advancement of HIV and AIDS treatment, those stigmas still persist. In my search for HIV people, not one agreed to an on-camera interview, scared of being marginalized.
If someone's HIV positive, it's a private issue. It really, nobody needs to wear a sign on their forehead saying I'm HIV positive. However, there are people that are HIV positive that are very much out about their infection, and I think that's great because when someone's out about their HIV infection, it means that other people that are HIV positive know that there are other people like that out there, that they're not alone.
Though medical treatment has come a long way since 1980, HIV's treatability could be the source of some people ignoring the risks and failing to take precaution.
I don't think the numbers are necessarily decreasing because gay men understand that because there's good treatment now, unfortunately they feel that, so it's like, so what? If I get infected, I can just go on the cocktail and it's not a big deal. They don't really understand that there's a lot more to go with that. It's not just a matter of taking medications. There's a lot of other baggage, so to speak.
So just because treatment is effective does not mean that you shouldn't take certain precautions. Practice safe sex. Get tested for HIV. You, your family, could be at risk. For Good Day DePaul, I'm Kipp Burrows.